Welcome, everyone, to the University of New Mexico Law and Mental Health Series, weekly discussions of practice and science featuring experts in behavioral health and the law. This series is run by the Division of Forensic Behavioral Sciences of the University of New Mexico's Department of Psychiatry and Behavioral Sciences in support with the New Mexico Behavioral Health Services Division. I'm Anthony Perillo, the Forensic Psychology Training Director here at the University of New Mexico. For our talk today, if you have any questions for our presenter, make sure you enter them in the Q&A box. You can enter those anytime you feel comfortable, but do know that we hold questions until the end, and oftentimes it's not possible for us to get through all of them. If you are pursuing continuing medical education credits, there will be a sign-in sheet posted in the chat box shortly. In fact, it should be there right now that you can sign in for. If you are pursuing APA continuing education credits, there will be a link also in the chat box for you to complete a survey to get your certificate for credits. But that link will be near the end of the presentation, about 5 minutes before the hour. So keep your eye on the chat box as the webinar is getting close to a close. Make sure you bookmark or open that link before the webinar closes so you have the link. And make sure that you save your certificate after you complete the survey. We don't have completed certificates after the fact. If you missed last week's talk in the series, Dr. Alexis Glomsky's discussion of nuances in assessing competency for defendants to represent themselves is now available on our YouTube channel. The recording for this week's talk will also be available on our YouTube channel sometime later this week, and a version of the slides will be accessible for those that have registered for the series later in the week as well. As a heads up, next week we have Dr. Karen Reimers, who will be discussing geriatric forensic evaluations. But circling back to this week, I'm personally very excited to introduce you to today's speaker, who will be discussing clinical evaluations of people with child pornography offenses. This is Dr. Cynthia Calkins. Dr. Cynthia Calkins is a licensed clinical psychologist and professor of psychology at the John Jay College of Criminal Justice. Her research centers on sex offense risk assessment, policy, and prevention. Dr. Calkins also has an active clinical practice doing forensic, immigration, and risk assessment evaluations. She's also used her scholarship to write a book on data-driven sexual violence prevention for a general community audience, protecting your child from sexual abuse, what you need to know to keep your kids safe. I'll also add, this is a personal honor for me. Dr. Calkins is my advisor from back in my PhD program. She's helped me so much in the years in a professional and personal life. I'm honored to continue to be in contact with her, and I've gotten to learn from her. So Dr. Calkins, Cynthia, on behalf of us at University of New Mexico, thank you so much for joining this series. And I'm very excited for you sharing your expertise with us today. And I'll go ahead and toss it to you.
Great. Well, thank you very much, Dr. Perillo, for that very nice introduction. And I'm honored to be here today, and I appreciate the invitation. And thank you all for coming today. I know that the Tuesday after Memorial Day weekend is a particularly tough day to get back in the swing of things. So I'm glad you all took time out of your schedules to be here today. So today I'm going to be talking about clinical evaluations of child pornography offenders. There are several objectives for today, identifying and describing the key components in the evaluation of child pornography offenders, understanding the strengths and limitations of current risk assessment tools, and applying ethical guidelines to evaluation and report writing. So to start, one of the things I want to mention is the use of language. I titled this talk, Evaluation of Child Pornography Offenders, but I did want to bring to your attention the generally preferred language, which is CSEM, child sexual exploitation material, or CSAM, child sexual abuse material. I'm using child pornography because I do mostly federal evaluations, and the federal code does still classify this as child pornography. But you see use of the CSEM and CSAM terms in the research literature, and as well, it tends to be more favored in international environments. So you see it in the UN's language, Interpol language, and so on. There is the use of child pornography has kind of some connotation that it may be voluntary on the part of the child, and of course, the child's participation in this is never voluntary. So use of CSAM or CSAM language centers the the activity on the exploitation material and not on the child. As you might imagine, this is a growing problem. The National Center for Missing and Exploited Children, who established their cyber tip line in 1998, has now received more than 195 million reports related to child sexual abuse material since its inception. And these reports, not only are they growing, but they have incredible, the impact on the victim is very serious. So a recent report out of Canada found that victims, particularly victims of who had been victimized by both contact sexual abuse and CSAM abuse, said that the distribution of their images affected them in different ways, and often more severe or long-lasting ways. So one of the things, for example, is that 90% of participants in this Canadian study said that they worry about their materials being found. Some 30% said that they were approached by somebody, which may have been an authority figure or somebody they know personally, who reported having seen their images. Sometimes victims don't even know that they have been victimized until they get a knock at their door and a report that that material has been found with their image. So this, knowing that it's out there and knowing that it's difficult to ever really sanitize the internet of a video or material once it's out there, can make the effect uniquely difficult or traumatic. So the U.S. Sentencing Commission from fiscal year 2019 through 2023 found that child pornography offenses were growing by nearly 3%. So that might not sound like a whole lot, but consider that this is against a backdrop of generally decreasing crime and decreasing sex crime. In 2023 alone, approximately 1,400 individuals were sentenced for a child pornography offense. This is broken down by 47% a trafficking offense, 44% a possession offense, and 9% a receipt offense. Most of these individuals were white males. Average age was 41 years. And 99% of these cases, in 99% of these cases, they were sentenced to prison, with the average sentence being 114 months or just under 10 years. So traffickers received the longest sentences, followed by those who had received material, followed by those in possession of material. So you might ask yourself why, if anybody who has worked with sex offenders or is familiar with the state level system, you'll know that sentence lengths vary, but are typically for a contact sex offense between around 5 and 8 years at the state level. Due to the federal sentencing guidelines and mandatory minimums, as you can see, nearly all end up sentenced to prison and have relatively long sentence lengths. Typically, the mandatory minimums in these cases might be 5 years for possession or 10 or 20 years for trafficking or receipt. Studies have looked at the differences between those who commit child pornography offenses and those who commit contact sex offenses. And generally speaking, those who commit child pornography offenses tend to be less antisocial or to have less criminal history, but have higher rates or higher levels of sexual deviancy. Okay, so what are the key components of an evaluation? So the first thing to consider is the referral question. And it's always important to clarify why you are being asked to do the evaluation. What specifically is the attorney or the person requesting the evaluation looking for? Is the question about risk to reoffend? Is it to help understand or contextualize the motivation? Is it for treatment recommendations, sentencing recommendations, something else, diagnosis? Whatever it is, be sure to clarify the question. And this is also a point at which you can discuss with the referring party, typically an attorney, what you can and cannot provide, and perhaps even the limits of your own evaluation. It's also a time that I like to discuss the fact that I'm an objective evaluator or trying to be an objective evaluator, um, and that I may not have an opinion that's helpful to the client. So I typically tell an attorney at this point that my findings may or may not be helpful to their client, usually based on just the information I get during this initial phone call. I can kind of get a sense of whether they're on the higher or lower end of the risk spectrum and relay that information just so the attorney knows what to expect from my report. A clinical interview, this is a key part of the evaluation and also important. In my own evaluations, I like to I include a section that describes just the facts version of the crime. So this is what's reported in the police reports or victim statements. But I also include a section to describe what the offender's own explanation or how they understand this crime to have happened, or alleged crime, I should say. Behavioral observations are important with regard to the offender. So their affect, mood, demeanor, memory, ability to organize a narrative, and so on. So one thing, for example, it's not unusual in federal cases for an evaluee to sit in prison for 6 months, a year, even 2 years before their sentencing. And so they've had a lot of time to think about what happened, and to organize a narrative or to try to explain. And many of them don't or are unable to do so. And so I always think that's relevant to my case or relevant to my own assessment of somebody's ability to make sense of their own behavior, or not make sense of their own behavior, even when they've got kind of lots of time on their hands. Diagnosis is often a key part of these reports. We'll talk about that in a little bit. The most common diagnoses in these cases is probably depression. As I mentioned, you see less antisocial personality disorder than you do in more general sex offense evaluations. Standardized testing may be used based on your observations and what you learned during the clinical interview. I might use personality tests, more typically a BDI, Beck Depression Inventory, Beck Anxiety Inventory, PTSD checklist, ACEs, trauma measure. If the referral question has to do with somebody's cognitive functioning, I might use an IQ test like the WACE, or a neuropsych measure like the repeatable battery for the assessment of neuro symptoms. Risk assessment, we're going to talk a bit about that, or a lot about that today. We'll go into detail, but generally speaking, research favors the use of structured risk assessment tools. Put simply, they have higher accuracy or better predictive validity than do unstructured or in your head judgments of risk. Most of these evaluations include a comprehensive sexual history, and this may include, but is not limited to, gathering information about early sexual experiences, abuse experiences, sexual relationship history, how many partners, what was the nature of the relationship with those partners, how many children do they have, any unusual or atypical sexual interests, frequency of sexual behavior, frequency of frequency and nature of use of pornographic materials, and masturbation habits, as well as any sexual problems or difficulties, infidelities in relationships, and so on. So that comprehensive sexual history often will help you to kind of contextualize and understand and give a little more depth to the breadth of this person's overall sexual health and sexual functioning and sexual interests. I'll In gathering that sexual history, I'll rely on collateral information as well from if they are married or have a partner or somebody willing to talk to me, I will corroborate some of that information on the sexual history. Um, Collateral information in these child pornography cases can at times be quite detailed. So in a typical sex offense case, you have the report of the victim, and the report of the victim when it's a minor child is often lacking in detail or can be lacking in a full understanding of what happened. Um, and so we have a bit of a kind of he said, she said sort of version of events, but often coming from a child who may be unable to express themselves fully or have an incomplete understanding of what happened. Um, in contrast, in these child pornography cases, we often get a great deal of collateral information because we have the sometimes what may be many, many pages of messages between a victim or multiple individuals and the perpetrator. We also get a clear log of what type of material they're looking at, so the age range, the gender, how much of the material is out there, and so on. If there are videos or photos, I can request to go take a look at that if I want to corroborate what the offender is telling me his interests are with what was actually being viewed. So that's in one advantage to these to the child pornography offenses, is that we have a great deal typically of collateral information, and it's hard to deny it or when we have it there in writing before us and know exactly what was said to these victims and what the entire context of that conversation or the sharing of material was. Of course, also collateral information, criminal justice records, arrest history, educational records, all of that is very important. And then last but not least, report writing. Most of the time you'll be asked to write a report for the attorneys to submit to the court. It's important in these reports to separate fact from inference. One thing that I do is to indicate Mr. Smith said that, he was abused during childhood, or records reveal that he was treated for mental health problems on 3 occasions. And then I have a clinical summary section that involves more case formulation and inference, trying to tie all these pieces together and provide some context to what happened, paired with the risk assessment and any diagnostic issues. So that last piece is sort of tying it all together. Okay. As I mentioned, these child pornography crimes can cause incredible harm to their victims, and these are very serious offenses that have long-standing consequences. However, there's a lot of heterogeneity in the cases, so the motivations are quite varied. And I just wanted to give a little bit of a taste of that by talking about some of the cases that I've worked on over the past year or so, and you'll see what I mean in terms of this heterogeneity. So, one of these, for example, was a 25-year-old male with a long history of crime and antisocial conduct. And he was in jail facing charges of attempted murder and was found to be producing child pornography from the jail. So what happened here is he had been reaching out and talking, communicating with adult women and communicating with basically any female that he could on the outside, and happened to communicate with a 15-year-old, and he asked her to send nude images, and she did. So that was considered to be producing child pornography. So in this case, it was only found because the government was in the course of their discovery was going through all his records from the jail, hoping to find information that might be useful in this attempted murder case, and happened to find that this young female had sent videos, or had sent, sorry, photos. And so he was charged with an additional production of child pornography crime while in the jail. Another case involved a 19-year-old who was profiting from trading porn. So this was a young male who had a history of making poor life decisions, dropping out of school, or not, getting fired from a job. And he had was involved in trading porn and was making a little bit of money off of it, although the money he was making was relatively minor, so $40 for the exchange of photos. So in this case, the attorney was questioning whether this was motivated, whether the motivation was financial or deviant, or perhaps both. Another case I got involved with was a mid 50s age male who this case took place on the border between the US and Mexico. He had been living, this was a Mexican male who was had been living and working doing construction in the US, decided to make a little bit of extra money by transporting drugs to the New York area. And when he crossed one of the bridges into New York and they did a search of his vehicle, his luggage, and his phone, they found child sexual exploitation material on his devices during that search. So again, the question was, is there interest in this material? What is it doing on his phone? This was a man who was married, who had children. There was no other indication of interest in child pornography, but there was significant amount of material that had been downloaded on his phone. Another case involved a very socially isolated 20-year-old who was possessing child sexual abuse material. This is a young man who described that he did not have a single friend during all of his middle school and high school years, felt incredibly isolated, believed himself to ever be competent enough to meet an age-appropriate partner, and thought himself on the same kind of cognitive level as younger females who he saw as less of a threat. So he was found to have had communications with younger females and was in possession of photos from those 14-year-old females. Another case involved a young, I think she was around 19-year-old female with a low IQ. She had been received support services throughout her education, and was in pull-out classrooms or got pull-out services. And she was coerced into performing sexual acts with her toddler boy for money. So she was received a small amount of money and performed sexual acts. In this case, it was my opinion that she was just as much a victim as she is a perpetrator. And last but not least, a recent one was an almost 80-year-old former teacher with a history of sexual offenses who was charged with child pornography possession, and who readily admitted to having deviant sexual interest. In his case, there was no doubt about his antisocial history and deviant sexual interest, but the fact of his current elderly age, and that he would be serving a 10 to 20-year sentence. The question was, how much risk would he pose at the point that he might be released when he's 90 or 100, which of course would be little or negligible risk at that point. Okay, so as I said, as you can see here, there's a lot of heterogeneity and motives and the broader kind of issues that may influence how one becomes connected to one of these crimes. So let's talk a little bit about diagnosis. Some of the more common diagnoses in these cases are the paraphilia diagnoses, and perhaps most common is pedophilic disorder, although pedophilic disorder, I would still say, is probably the exception rather than the rule. Pedophilic disorder is diagnosed when there's intense and recurrent sexual fantasy, interest, or behavior with minors, typically age 13 and below. And most of these, even you can see from that smattering of cases that I just presented, that most of these would probably not qualify as having pedophilic disorder. Certainly that last one, the 80-year-old would. The other ones, there is only partial or mixed evidence. So I'm very careful in my reports if there's not clear evidence of a paraphilic or other disorder. I'm reluctant to diagnose it. There's a lot of stigma associated with these disorders, and I want to be certain that somebody meets full diagnostic criteria before I include it in my report. So it's not unusual that I'll write there's only mixed evidence, or they have some features of the disorder but don't meet full criteria. And perhaps this is something that should be ruled out in a future evaluation or with more information. Also, sometimes in sex offense evaluations, although not so much in the child pornography ones, you will see the use of these sub-threshold categories like other specified paraphilic disorder and unspecified paraphilic disorder. Sometimes they are used in the you'll see other specified paraphilic disorder with the label hebephilia. Hebephilia, although there's no clear or set definition, it's understood to refer to sexual interest or behaviors with minors who are not prepubescent like pedophilia, but pubescent. So in that 13, 14, 15, maybe even 16-year-ish age range. And like I said, you don't really see that so much in these evaluations. It tends to be used only in sexually violent predator evaluations where a diagnosis is needed to meet the commitment criteria. There's a lot of controversy around this diagnosis. I don't recommend using it. It has been explicitly rejected by the DSM subcommittees on multiple occasions. Because of a lack of validity, because of also a lack of evaluator reliability in the diagnosis of these other specified categories, and even hebephilia, where we don't have any kind of criteria set. So I advise against using it, but I did want to mention that you may see that. Okay, so as a backdrop, in thinking about these evaluations, one thing to consider is how often do offenders recidivate? So what are the base rates of recidivism? To start, let's talk about the overall rate of sex offense recidivism. So Carl Hansen's earlier studies, you may see in the literature, it's often reported that offenders have around a 13 to 14% likelihood of recidivism over a 5 to 7 year period. More recent analyses, so this 2018 study, shows that those estimates might actually be a little high. This 2018 meta-analyses found a 5-year recidivism rate of 9%, a 10-year sexual recidivism rate of 13%, and a 20-year sexual recidivism rate of 18%. The longer we stretch that follow-up period out, the more likely recidivism is to happen. But overall, the base rate tends to be lower than at least the lay public would assume. I think if you were to ask most people on the street with no specialized knowledge of this, they would expect that most sex offenders recidivate and continue to commit sex offenses. But the data don't bear that out. Of course, it's important to note that most sex offenses are undetected, and so we never know for certain what the true rate is. One thing to think about, one thing I'd like to bring into your attention too, though, is the sexual recidivism rate for child pornography offenders specifically. So if we just take child pornography offenders, an undifferentiated group, so that's any kind of child pornography offense in their history, the average 5-year recidivism rate is 5.5%. And that overall rate of 5.5% over 5 years, recidivism with a contact sexual offense is about as likely as contact sexual recidivism for that undifferentiated group. If, however, we look at those with only child pornography offenses, they have a slightly lower 3.9% rate of any sexual recidivism, but that recidivism is more likely to be child pornography recidivism and very low rates of contact sexual offenses. So individuals with child pornography only offenses are about 1.4% likely to recidivate with a contact sexual offense. That's pretty low, particularly when you consider the rates of spontaneous sex offenses within the general population, which are best estimates put at about 1 to 1.5%. So that means the rate at which anybody with a criminal or non-criminal past living in the general population will commit a sexual offense is around 1 to 1.5%. Kind of mirrors the likelihood of a child pornography offender committing a contact sex offense. The rates are higher, though, when we include those with a child pornography and a contact sex offense. So they have lower rates of child pornography specific recidivism of 1.1%, but higher rates, 3.4%, of committing a contact sexual offense. So why use risk assessment tools at all? Well, a number of reasons. Probably most important is to enhance the accuracy. So a wealth of research has shown that they simply have higher predictive validity. So they're more accurate in predicting the outcome of interest, which in this case is recidivism. They minimize bias. So it's a fairer process, and that is the same criteria applied to individuals. And enhance transparency. So the trier of fact or whoever's making the decision can see very clearly how this decision was made. What are the factors that were considered? How were they combined? Everything is more transparent. So these tools tend to simply be better. There are, however, that's not to say that there are not limitations of risk assessment tools. And primarily the biggest limitation is that they work differently for different populations. And we'll talk about that a little bit at the end when we discuss cultural considerations. But it's important to be aware of the group upon which the individuals were normed and validated. And if that group looks very different from the individual that you are assessing, they will probably be less accurate in predicting someone's likelihood of reoffending. So you have to consider how much your individual looks like the sample upon which it was normed and validated. Do we have that data? And if not, you want to be very careful and judicious in your use of these tools. So how good is good enough? How good do these tools have to be for us to use them? Well, in answering that question, one way to frame it is to think about how well unstructured tools work. So in your head, unstructured professional judgment has an AUC value of about 0.56. So AUC, or area under the curve, values indicate an AUC value, of about 0.5 is chance prediction. So that would be, and an AUC of 0.56 is just above chance. So actuarial structured tools on average have AUC values in the range of 0.68 to 0.75, pretty moderate to trending toward high levels of predictive validity. Just as a frame of reference, clinical prediction tools in medicine range from about 0.64 to 0.88. So for example, diagnostic tests to predict heart failure are going to be in that 0.64 to 0.88 range. So the actuarial or structured tools that I'm going to talk about today are pretty good, and definitely better than unstructured professional judgment, but we might have a little bit of room to grow to get them more in the range of tools, clinical prediction tools in medicine. So there's certainly room for growth, but they do pretty well in enhancing our accuracy about these judgments. So what tools can we use with this population? So recommended tools for assessing risk of any sexual or CSEM, specifically recidivism, are the CPORT, the Child Pornography Risk Tool, developed by Michael Cito and Eek, or the Stable 2007 tool. There is partial support for the Static 99 risk assessment tool, which we'll talk about. So only one study has examined the predictive accuracy of the Static 99 with the CSEM population. And it did show, in that study, that it was able to predict any sexual recidivism or CSEM sexual recidivism specifically. So it may be defensible. The Static 99 looks like it can work with this population. There's at least some partial or limited support, but at this point, it's probably better, or I'd say it's better to use the CPORT tool. There have been more validation studies, and again, it was designed specifically for use with this population. The Stable 2007 has been shown to add incremental validity to both the CPORT tool and the Static 99 tool. Generally speaking, more is better, and these tools have additive or incremental validity. So most of the time, I will use either the CPORT and the Stable 2007 or the Static 99 and the Stable 2007. So what is the Static 99? It's a 10-item actuarial tool for use with adult males with a history of sexual offending. Most of the tools are demographic or historical in nature, and it's meant to position offenders in terms of their relative degree of risk. So we don't know anybody's absolute degree, but we have a sense of a relative or rank-ordered level of risk of reoffending. So lower scores, I should say, the scale ranges from -3 to 12, and lower scores are associated with low risk. Higher scores are associated with considerably more likelihood or probability of reoffense. The Static 99R is the most frequently used scale in all sex offense evaluations. So not just child pornography, but all sex offense evaluations. And overall, it's been found to have moderate predictive accuracy, or in a recent 2022 study by Helmus found an AUC value of 0.68. And that means about a 68% chance that a moderately randomly selected recidivist would have a higher score than a randomly selected non-recidivist. So of note, the static 99, however, cannot be used with offenders only charged or convicted of possession or distribution of child pornography, unless the behavior involved the creation of child pornography with a real identifiable child. So if you think about those examples I gave earlier, there were two cases where somebody was charged with the creation or production of pornography. The 25-year-old antisocial male who received photos from the jail cell. He was charged with production because he had coerced the female into sending these. And the young female who produced content with her minor toddler child. So according to this language, I think you technically could use it. I personally wouldn't. I don't see either of these cases as kind of falling within the spirit of what's meant by somebody charged with a production of child pornography offense. So I would probably be more likely to use the CPORT or another tool. So the static 99 can be used with those who have a contact or non-contact sexual offense charge or conviction with an identifiable victim. So the CPORT tool, as I mentioned, was specifically designed to assess risk of recidivism among men convicted of CSEM offenses. So the CSEM then predicts both any sexual recidivism and CSEM recidivism specifically. How good is it? It is pretty good. The CPORT range of the predictive validity is moderate to high, with AUC values ranging between 0.68 and 0.75. So right now, it's the best tool that we have for evaluating CSEM offenders. And these recent meta-analyses support its use, although its development is still pretty recent, and it certainly doesn't have the quite as large of a research base as does the static 99. So there's good reason to use it. It certainly seems to be, the data show that it can enhance our predictive accuracy, but there are reasons to be careful and cautious and circumspect in using any tool with this population. What does the CPORT tool look like? It's got 7 items, 7 static or historical items that assess general antisociality and pedophilic or hebephilic sexual interest. You'll see here that a number of these items look like what we have on the static 99. These are research-driven factors that have been found to predict sexual offending. So things like having a prior criminal history, offender age, which maps onto risk. Here in the CPORT, offender age is dichotomized as below 35 or above 35. So age, any history of offending, any failure on conditional release, and much like we see in the static 99 tool, also having male victims, or in this case, boy rather than girl content in the pornography, is associated with higher risk of reoffense. Next, I'll mention briefly the Stable 2007. As I mentioned, this on its own has been shown to be able to predict CSEM recidivism, but it's usually used as a complement to the CPORT or the static 99 tool. It's a widely used measure of dynamic risk. I'm sorry if you can't see those items, but the items include things like emotional identification with children, hostility, general social rejection, lack of concern for others, poor problem solving, negative emotionality, that kind of thing. This tool will add incrementally to your risk assessment and can help inform treatment or supervision, as these dynamic factors can be are often used as treatment targets. And as I said, it can be used to assess CSIM recidivism specifically, or any sexual recidivism. Because it was in this recent study, or because it has been found to predict CSIM recidivism, the original guidance said that on this tool was not to use it for CSIM offenses. But because the data show that it can predict outcomes for men whose only offenses are CSIM offenses, recently a frequently asked questions document was released for the Stable 2007, indicating that the tool could be applied to men convicted of CSIM offenses, so replacing this original guidance for the tool. Okay, last, I mentioned some cultural considerations. So most of these tools, the tools that I mentioned today were developed in Western cultures, and on Western samples in places like Canada, the US, Europe. The validation studies have almost always been in these Western contexts. So it's important to consider how differences across race, ethnicity, and culture may affect the validity or utility of these risk tools. Tools work differently across different racial or cultural groups, and it's important to be aware of both the samples that has been normed and validated on. And you want to ensure that the individual being assessed is similar enough to those in the research samples, or that validity research has been done on the unique sample that you're using it with. So for the static 99, as I mentioned, there's a pretty large research base, and evidence supports the use with Black men, but there's mixed evidence for its use with Latino men. In particular, Latino men, it tends to work better with Latino men born in the United States than it does with those born outside of the US. There's also reduced or very limited accuracy for use with Indigenous men, although reports indicate that evidence does support use with Asian men. So whatever the sample or cultural group that you're using it with, you want to make sure that the tool has validity. I regularly do, as I mentioned, evaluations for individuals in immigration proceedings. It's not unusual for these to involve sex offenses. So I'm very careful, as I know that most of these, or all of these immigration cases involve individuals who were born outside of the US. There's very few of these these tools haven't been validated or normed with Latino men outside of the US, so have less accuracy. So I think we have to be careful in finding that balance. They're probably the best that we have, but I'm careful not to over rely on them when we simply don't have as much data or as much research telling us about the validity of these measures. Or knowing with the limited research that we do have that they has more limited predictive accuracy. Also, consideration of cultural identity and acculturation. In some of the cases I've mentioned, the individuals have been newer to the US or might have spent less time here. So considering how their own cultural values or how much they have adapted to the dominant culture, that can be really relevant in their understanding of rules, understanding of behaviors, and so on. Language and communication is important. Sometimes it's necessary to use a translator, although if that can be avoided, that's best. Translation may, of course, alter the meaning of what somebody says. I know I'm very careful in my own evaluations to make sure I really want to make sure I understand exactly what the person is telling me. There's a lot of nuance. Detail is important. And if somebody's first language is not English, I do speak Spanish, but I'm very careful as a non-native speaker that I want to make sure that we both understand one another perfectly well. Cultural concepts of distress. So there is, of course, different cultures express distress in different ways, and we want to be careful about that and make sure that we understand the different ways that distress may be expressed. Many cultures, for example, have more stigmas around mental health, reporting of mental health symptoms, or attending treatment or so on. So if you want to be aware of that and consider if how cultures may view mental illness, whether they view it as something that's shameful and may lead, therefore, to the underreporting of symptoms. Okay. Okay, and so last, of course, you want to be aware of the ethical code should guide your practice. So the APA ethics principles, and also the specialty guidelines for forensic psychology should guide your practice. As well, you want to make sure that you're competent in the area that you're doing evaluation. So competence means having specialized knowledge. So as a forensic psychologist or someone doing this type of evaluation, you should have training in both the psychology, but also the legal standards, and understand the questions being asked that may be relevant to this case. Next, in terms of ethical considerations, accurate and objective reporting is crucial. So it's really important to make sure that you're being objective, to make sure that you're being fair, to make sure that you separate facts from inferences, use as much data as you can, and be careful. We'll talk about this next, the pull to affiliate. Be careful about the pull to affiliate. You have a responsibility to the legal system as well. Research has shown that evaluators tend to side or score instruments or find in favor of the side that has hired or retained them. So even on structured measures, evaluators tend to produce scores that are more in line or slightly more in favor of the side that retained them. This happens less so with the more structured measures like the static 99. So wherever possible, use more structured measures and be careful, try to be self-aware, so that you don't, fall into that tendency to affiliate with the side who is retaining you. And also malingering and deception. So in a lot of these, in forensic work in general, malingering and deception is to be expected to some degree. People are facing lengthy prison sentences. There's certainly motivation to minimize, to deny, to present as something other than, to provide a narrative that is more favorable to them. So it's, as much as this is to be expected, there are ways that we can measure this. Like I said, with the child pornography cases, we've often got extensive or detailed chat logs or material. So it's, it's easier to perhaps reveal the truth of what went on. At the same time, I understand that it's strategic for people who are in these situations to minimize their offenses, and so I think we have to be careful about making too much of that, because it's what many people would do in this situation. Oftentimes, or sometimes, I get the opposite of people who are overly. I recently had a case of a very young man who was worked on a cruise ship and had committed an offense, and he had some history of sexual deviancy, and was incredibly open about his interests and and behavior, so things that were not on the record or were not in the reports. And it was, as I wrote in the report, that this is helpful or will serve him well from a treatment perspective. And I think he will be able to, they'll gain from treatment. At the same time, it's not a particularly strategic response. And as somebody who had a history of acting impulsively and poor decision making, I think his decision in this case to be as open as he was probably reflected to some degree that tendency toward impulsivity and not thinking through fully the consequences of his actions. Okay. So, and last but not least, I think it's important to mention that attorneys are often fierce advocates for their clients. They are requesting these evaluations because they want them to be of help to their clients. But it's important to be objective, to be fair, and to remember our own ethical responsibilities as psychologists to provide an accurate and objective report. Sometimes I'll be asked to kind of soften a finding or take out something that might be prejudicial. I'll consider this on a case-by-case basis, but above all, my requirement or my duty here is to provide an objective and ethical report. Okay, and I'm looking at my clock, and we are just about out of time, so I will be available for any questions.
Thank you so much, Cynthia, Dr. Calkins, for that very practical, in-depth overview of a lot of things that go into these evaluations, as well as, of course, of the work that you've done in this area and communication of these findings to a lot of audiences over the years. In the chat box is the link for the CEU survey. There are, of course, a number of questions here already. I'll go through a couple of them, but once we get to the top of the hour, of course, you have met your CEU time. The link is in the chat box. Like I said, we'll stay for a couple of questions here. Several people referenced when you got to the risk assessments section and mentioning several items or several measures rather. Several people brought up the Risk Matrix 2000 and wanted to say, what are your thoughts on this tool? Do you have any concerns about using it? Any thoughts on the Risk Matrix 2000 in particular?
Yeah, so the Risk Matrix 2000 has, I think it's a well-validated tool that also is of use for general sex offense populations. There is some more partial or developing data for use with CSEM populations specifically. So I think it's fair to say that we can, it's a great tool, a good addition to the arsenal of tools for general sex offense evaluations, but you want to be, and it may be of use for the question of CSEM recidivism specifically.
Great, thank you for that. Somebody, when you brought up the C-port, expressed that their concern is that the C-port includes those with and without contact offenses rather than people that just have child exploitation material offenses. One, I guess, thoughts on that, and two, I guess I'll tie on a related question that people have asked is, what is the general rate for people that have child exploitation material offenses of also having contact offenses?
Yeah, so it's pretty low overall. I want to say, and don't quote me on this, I want to say it's around 5%, but it's on the lower end. And so the question, I'm sorry, is?
Somebody had concerns about the C-port, including a sample that has both types of offenses rather than people with just child sexual exploitation material offenses. That was the original question, at least. And then I tacked on that last one of how often is this actually the case?
Right. So with the C-port, though, you can use as your comparative sample individuals with only CSEM offenses and predict any sexual recidivism or CSEM only recidivism.
Wonderful. Thank you for that clarification there. Somebody asked, what are some of the more challenging aspects unique to these evaluations that evaluators tend to need to develop competency in over time? Do evaluators need formal certification or specialized training for these types of evaluations? Or in your experience, can professionals build off their expertise from related areas, such as their training in risk assessment or treatment, to do
Mhm.
these kinds of evaluations?
Yeah, great question. So, yeah, anytime there's specialized training available, individuals should avail themselves of that. So, for example, there are often static 99R trainings. I know I've seen trainings for the Seaport tool, and so certainly you should attend those and gain that expertise. Um, but also, yes, absolutely, you can build off of previous knowledge. And a lot of what I've described here today, or a lot of this is relevant to forensic psychology reports in general, or working within the system. So having the competence, the expertise, and the sorts of considerations in any report would apply to these reports as well.
Somebody asked, they would love to hear your thoughts on any considerations related to juveniles charged with these kinds of offenses. And they clarify not material, of course, with same age children, but with
Mhm.
children much younger than the youth themselves.
Yeah, that's a great question. And I have yet to have any, I haven't had any of those cases. It's such a new and developing I'd be very careful about those cases because we don't have the research basis. The nature and often these sexting offenses are relatively new. They may not have the same motivational factors as an adult who is, sharing material or soliciting material from a minor. So I think there's a lot to consider. Personally, I would um, proceed with caution and I think be more circumspect or careful in those cases, given that the field is still kind of catching up with this phenomenon.
Great. And one final question to wrap all this up. I know we have tons of questions here, not possible to get to all of them again. But generally, what advice could you give a therapist who is just starting out helping people who have been viewing child sexual exploitation material?
Okay. Um, I think the advice I'd give a therapist is probably to maybe consider the stable 2007 items and use them as treatment targets. They are known to, each of these items has a relationship with recidivism, is known to predict recidivism, and they're all suitable treatment targets or focus. So I think that would be a great starting point to consider which ones are elevated and and adapt treatment to dealing with those.
Dr. Calkins, Cynthia, thank you so much for joining us again and sharing all of your expertise with the audience. And of course, on a personal note, thank you for everything from my own training over the years. That's great, greatly appreciated, and I'm very thankful for you sharing all of this with the audience today.
Thank you, Dr. Perlow. It was a pleasure to be here.
And that wraps up this week's Law and Mental Health series. We hope to see you next week when Dr. Karen Reimers will be discussing geriatric forensic evaluations. We hope to see you then for another great discussion of issues in behavioral health and the law. Until next time, take care.